My voice was like number one.
What is Wraparound with Intensive Services, WISE for short? In July 2014, Washington State's Department of Social and Health Services introduced a new way to offer support for youth who are experiencing significant mental health challenges so they can safely live and thrive in their homes and communities. This video will provide you with a basic overview about Wraparound with Intensive Services and where you can go to find more information. Currently, WISE is designed to provide comprehensive behavioral health services and supports to Medicaid-eligible youth up to 21 years of age with complex behavioral health needs. In general, WISE is focused on the children and youth that are involved with multiple systems. Washington State is committed to their 10 core behavioral health principles. These principles empower youth and families to drive their care towards success and are the foundation upon which WISE was created. Putting these principles into practice is key to families experiencing success and youth being able to remain in their homes, schools, and communities. When a youth and family become involved in WISE, there are 3 main components they receive. The first is intensive care coordination. So, how do we do this?
I think I've gotten feedback from families about, if this had been around maybe a couple years ago, that they could see where it would have been really helpful. And there's a huge need for it. Anytime we've done any community outreach, families, professionals, everybody's like, tell me more. What is this really about? What can it really do for our community?
Coordination is achieved through a wraparound approach in a team planning process called child and family teams. These meetings include the youth, the family, and all the people that support them. Meetings with the child and family team occur on a schedule that meets the needs of the youth and the family and should occur at least monthly. Every youth and family enrolled will be assigned a WISE-trained care coordinator who will facilitate the team planning process, collaborate with cross-system partners, ensure that services are coordinated and the youth and families' needs are being met. Cross-system partners can include child welfare, juvenile justice, mental health, education, developmental disabilities, and physical health, just to name a few. The goal of WISE is for each youth and family to have a team of supports around them that includes more natural and informal supports than formal ones. This means that the ultimate goal is to have the majority of the team made up of family, friends, and neighbors naturally supporting the youth and their family. The team's focus is to work diligently on the established goals in order to achieve the team mission and move the youth and family closer to their vision. Youth partners and family partners with lived experience will also be available to youth and families to provide peer support and to help empower them in the WISE process.
I think with anything that you go through in life, if there's any obstacle or challenge that you have to face, being able to be partnered up with somebody who has had a similar experience and made it out on the other side is very empowering. You're able to look at them and say, well, they were able to do it, so that instills some kind of hope that maybe I'll be able to do it.
You're doing something that you're good at, and if you put your heart into what you're doing and you love what you're doing, then you can't do it wrong. That's the thing. And if somebody's doing something that they're not feeling it, it's not gonna be a good final product. But when somebody's really putting their all into it, then it's like meant to happen kind of thing. So yeah, straight base is very important because being able to put your heart and your effort into it, it's a beautiful outcome. So.
after I started seeing those different strengths and being able to use them in different areas of like my work and helping people, like it really made me see how many strengths I had, and as it progressed, it just brought me happiness knowing I had all that and knowing I made a difference in my own life.
When a youth is referred to WISE, a screen is completed, which includes a communication tool called a CANS, the Child and Adolescent Needs and Strengths Assessment. This tool really helps paint a picture of the strengths and needs of the youth and family for all the team to see. The CANS will also help to inform the team where the youth and family are in the WISE process regarding goals and transition. The second component is intensive supports and services provided in the youth and family's home and community.
Why? Because in the community is where the change needs to happen. They can go through many changes in the institutions and then come back to the community, but the community is going to stay the same. They need to make the changes in the community so there can be a real change. Real change within themselves, real change within their family, with the community, with the community partners, and that's really how to make a difference.
These supports and services are identified after the youth, family, and team have an opportunity to identify strengths and needs, develop a family vision, create a team mission, prioritize needs, and develop goals to meet those needs.
Really being able to sit together, brainstorm, be creative, and be patient to get the needs of our family met was really a wonderful experience for us. My child was able to be diverted from a clip placement based on simply looking at what the true needs were of our family. I had many people in my life that jumped to service delivery. Oh, your child needs inpatient treatment, or your child needs to go to an anger management class. And it was very inspirational to sit and look at what was under those needs, to be able to come up with the true needs and create a plan that was more needs-based than service-driven.
The third component of WISE is that youth and families have access to crisis supports and services around the clock, 24 hours a day, 7 days a week. The youth receive services from an individual who is familiar with the family and their individualized crisis plan. This can include getting crisis services at a location that meets the needs of the youth and family.
For so long and kind of in our own little family world of crisis, we kind of felt we needed to contain it. It actually helped us to see that there were more supports out there for us. We didn't need to stay shut out in a tiny little corner of our own little world and be in crisis mode.
I get a lot of support from them. I started off in the Wraparound program. I wasn't, stable, and just seeing where I've gone in 6 months, I have a car, I have a license, I have a job, just being so successful, and with everybody staying by my side on that's really helped me. And that's a really positive thing, is that they were by my side the whole time.
This response was put into a legal settlement agreement that says this program will be available in every county across the state by June 2018. Please visit our website to learn more, including details of the state's response to the class action lawsuit called TR et al. Versus Quigley and Teeter. Also on the website, you will find information on how you can find out which counties are currently providing WISE, when you can expect WISE to come to your community, who you can contact within your community to make a request to WISE, and how you can get involved in providing feedback to improve services.
sings little songs called KG. With the teacher, yeah. There's no stopping, so just gotta keep singing along. Yeah.